Hi, this is Dr. Katina, and this tutorial is to introduce you all to the scope and ideas of this project and its background. The title of this study is Pre-Neoadjuvant Rehabilitation and Activity in the Gynecologic Oncology Patient Population, and we've called that PARAGON. Pre-neoadjuvant means that we are looking at those patients that are receiving chemotherapy prior to any other treatment that they might have. So prior to radiation, surgery to reduce disease burden, tumor size, and frequently these patients have additional comorbidities putting them at risk. Up to 75% of individuals with cancer experience disability, and what happens is this just decreases the quality of life during and after treatment. And among gynecologic cancer survivors, 60% experience cancer-related mobility disability. So we're losing the quality of life by decreasing the ability to move, which is likely affecting other comorbidities, such as blood pressure, gait speed, and additional issues. This study is to look at the early initiation of a type of rehabilitation activity type of program. This can decrease cancer-related disability and improve the quality of life. However, it's rarely a part of cancer care. Fewer than 10% of cancer patients receive any rehabilitation. And usually it's only implemented when there's been a chronic, consistent, persistent complaint of disability. So maybe after treatment, there's a loss of range of motion, there's chronic pain. So it's usually considered after the fact when it has been a persistent complaint. Therefore, this is a lack of proactive approach, and we're not preserving the function that patients are coming in with and trying to assess what they already have and then have it continue, and we're not preventing disability. In terms of this data extraction, it's a part of the scoping review, which is the first aim of the project. We're trying to find what the current state of the literature says about these types of rehabilitation programs to help build the most effective components into our intervention program as possible. First, there was this search of the literature that found these papers, and now we're going through the papers, and we have the online form to extract whatever data we can that's going to support the most effective and efficacious components of cancer prehab, how these findings were implemented, and then how usable and feasible these interventions were for those studies. Right now, this is the foundation and compiling evidence based on rehabilitation components that have been used before. So these can be imported into a comprehensive clinic-based nurse-led intervention. We are assessing out of these articles what types of prehabilitation interventions have been used in other solid tumor patients and looking at the effectiveness of those components and what, again, were the most feasible, what could be implemented the most effectively and not disrupt a busy clinic that we have, such as at McGee. And we're going to iteratively try to improve this before we use it in a larger study. But this is really the foundation of finding the most effective components that we can build into this intervention. What are we going to be looking at in these papers, and what can you look for to possibly glean and document in your data extraction? First, assessment and triage. The pros are the patient-reported outcomes. Those are some of the outcomes that they might be looking at pre and post, so surveys and that type. And then they're going to be possibly evaluating performance-based measures such as a 6-minute walk test, balance tests, and other types of history that the participants might have. And then looking at to see what type of other components did they use. Did they do independent or supervised exercise? Did they have PT, OT, speech, nutrition? What types of other components did they include in their intervention? And then lastly, what we are considering one of the most important parts of this intervention is we want the patients to be self-supported and be able to facilitate them in the best way possible to maintain this activity and maintain this intervention to prolong their function. So we want to look at what other studies did that helped improve adherence, if they had problem-solving skills, if they touched base weekly, if they had some other sort of self-monitoring wearable device, if they did a remote Zoom. Those are components that we are very interested in. The last page here is just a sample of outcomes and measures that we are looking at. So if you had a question, if you see something in your paper, in your article, and you're wondering if it's a functional outcome measure that is included in and should be documented, this is a sample listing of ones that we are going to be using. So this is just to help you out. We thank you very much in advance for your assistance with this. It's invaluable to us. So thank you very much. I'll see you on my next tutorial.